Thank you so much for joining us here, and that even in a short week. But for our digital health on air audience, but not here, excited for our episode today, and we have an all-star guest with Anika Gardenhire, who is the Chief Digital Information Officer at Ardent Health. But she is not new to all things digital and all things transformation. She's really made a career of it, having really been at the forefront and the vanguard of leading digital change across the healthcare space at Centene, at Intermountain Health before that. So a real treat for our audience here. And we're really, really excited to dive into a topic that, of course, is top of mind for everyone, whether they want it to be or not. And, a lot of it for good reason, and a lot of it probably for a little too much hype. But it's AI in healthcare. And so, it's an area that rightfully is getting a lot of buzz. Peak hype cycle, very relevant to so many of our workflows in healthcare. And you've, of course, been living it. And as you point out, AI is not really new in a lot of ways. And so tell us more. Like you've been leading change for so long. Like would love to benefit from your perspective there.
Yeah, so I am just like most folks, right? As a consumer and user of technology, and a person who's always thrilled about it, and probably a little too much of a Kickstarter enthusiast. I love the hype cycle, right? I love living on it, and I love adopting new technology. And I always want us to be sort of like really, really honest about what it takes to make it work, and what's been around and what's not. And like I have been that person who like loved taking things apart and sort of understanding how they work. And so for me, it's really just sort of watching a lot of what we're calling AI, and understanding that, hey, oh wait, no, that's some of the stuff that like Homer Warner was doing. And those are things that I read about like in my papers in graduate school. And now we have like this new amazing compute that nobody's actually talking about, that's actually powering these things differently, that allowed them to take on new tasks for us. But that's not AI, right? That's like really wonderful, actually relatively stable technology that can run at scale differently, which is also super cool. And so for me, it's about sort of helping us separate the nuanced differences between like what is truly artificial intelligence, and like what's going to take like neural networks the size of buildings to run, and like what are those things, versus what are these like really cool sort of BPMN and other types of networks and other types of algorithms that we've had around for lots of years, that are well studied and understood, that now with like new amazing infrastructure, creations around compute and storage and bandwidth and those types of things can run differently and can take on new amazing tasks. My biggest thing is to like allow all of those things to be like similar levels of hype, right? And to have us use them appropriately so that we are making the right application for the right tasking. So, yeah.
Okay, well, I love that, because I think you're translating and really channeling the power of hype into tangible impact.
Right.
And so, what are some of those areas or examples where you think there's real opportunity, and maybe you're already applying it in your current role, or your peers are in their roles?
Absolutely. One of the things that I often think about is computer vision, right? So computer vision is super cool. And whether it's like true computer vision, or it's like some replication thereof that sort of found its way into like AR and VR and those types of spaces. The reality is that oftentimes there are things that we call artificial intelligence that's really like older computer vision technology, right? That sort of understanding of space and spatial awareness, and the ability to sort of manage and have machine learning take advantage of visioning, right? And picture visioning. And so I'm watching sort of what's happening, for example, oftentimes in whether it's, virtual nursing or virtual attending, or some of these other cases. And I'm going like, this is amazing. And it's a really awesome application around areas like computer visioning technology or summarization technology. And yes, I would say that there are like newer definitions of artificial intelligence that also play into that. But so much of that is what I'm calling like stableware. like where like it's actually really stable technology that we've had around for a long time, and we're sort of reimagining the use cases around it. And I think it's really amazing. I think it has amazing applications. And I think it's tackling real problems in healthcare, which is like we have an untenable like nursing staffing issue in healthcare. We have to make sure that we can keep clinicians in the workforce for longer. We need to make sure we have appropriate retention. We need to make sure that the work itself is easier on the human body and the human mind, and that we can still provide similar levels of care for people. And we have more and more sicker patients entering as new populations for us to take care of. And so for me, again, it's about saying, where is it that we have very real problems in healthcare that we know we truly need to tackle? And where is there very real technology that we can apply to that problem? And then being really honest about where that technology is on the hype cycle. Like, is it super early? Do we actually understand it? Or actually, is it really well understood, but maybe we didn't have what we needed from an infrastructure perspective to roll it out at scale, and now we do?
Well, I love that you brought up, one of the most important stakeholders, which are the care team providers themselves, like the care providers themselves, right? So the nurses, the physicians, other care team members. When the technology they're using today, some of the visioning capabilities that you referenced, what is their experience, and like what are some of the anecdotes you hear fresh from the field?
It's like most things, right? I always say the hardest part of being in technology and healthcare, it's not the tech itself. It's not building it. It's often not deploying it. It's getting people to adopt it. My personal perspective is that, if your widget doesn't actually get a human to do something different tomorrow than they did today, then your widget didn't matter. Like I'm very sort of focused on ensuring that the products that we're implementing, the things that we are doing are impactful positively on human life. And that means that we have to get, clinicians, users of this adaptive technology to be very proficient at it, not just to sort of pick it up and look at it, but to pick it up, look at it, deeply understand it, implement it into their workflow, and then be able to apply it in like every appropriate situation where the application makes sense. And that's incredibly hard. Right. And that's oftentimes not technology. Now, it is sometimes technology because design matters and you've got to make it easy to use and it shouldn't be overcomplicated. But it's all that other stuff, right? It's training. It's the actual focus on adoption. It's appropriate elbow support. It's actually implementing it into the workflow. It's doing the stop, start, continue documents. It's the change management sort of package, full stop, that you have to apply to it that makes it really work. And so for me, I've been incredibly fortunate at Ardent to have great partners in clinical leaders. And what I find is that when the clinicians are not only involved, quote unquote, but when the clinicians are leading, right? When the business is leading, when operators are leading, when revenue cycle staff are leading out on clearly identifying the problem, and they agree that they want to solve it, then the application of the solution is so much easier. What I find is often the difficulty is, hey, I have a really cool, shiny object. Let me see if you have a problem. Let me see if you have a problem. I'd really like to get that in the door. And then you get sort of what I have learned and actually coined from another leader, Darren Schulte, and from a previous life, you get the immune response, right? Which is like, virus, get out, attack, right? And so instead, if you can create sort of that native opportunity to ensure that, you are looking for solutions that the business has decided they have problems surrounding, then it's such an easier conversation. And I think that partnership is so incredibly important. And so we've gotten great reviews around the work that we've been doing when we apply novel technologies, but it's not necessarily magic, even though I have an awesome team and they are wonderful. It's the partnership. I think that's the key.
Well, Anika, I love the thoroughness and the completeness and the purposefulness of what you're articulating. It reminds me of we had a guest at an earlier episode, Dr. Tarun Kapoor, who was talking about AI, but was talking about technology, and he really hit the same nail on the head, which was, hey, you have to start with the real problems, real pain points, and strategic imperatives, and then you can apply people, process, technology to it, not have technology that's looking for a problem to solve.
Absolutely.
And so I think that's especially true in the AI hype cycle that we're in. Is there's a lot of cool tech, but if you're starting with like real pain, and you articulated like healthcare providers, that's an area of real potential impact. And if it's done well, it can really, really be impactful for an individual, and then of course all the people that they provide care for.
The last thing I would add is that when you do that well, you get more grace, right? And so the other thing we don't often talk about on the hype cycle is like, how stable is the tech? How well will it really work? How much have you had the opportunity to test it at scale? And at the end of the day, we are applying our technology to scientists, right? So they understand experimentation, they understand when something is supposed to work well, they understand rigor, they understand discipline. And so if we're applying something that's super early on the hype cycle and we force them to use it, you have no grace, right? But if you say, hey, I understand you have a problem and I have something novel that I want to try, folks can go down the road with you and give you some grace in a really different way.
Absolutely. No, that is spot on. And I think often overlooked by technologists who are really excited about their tech and maybe somewhat familiar with the problem or a problem statement or set of problem statements. One of the problem statements we hear from leaders like yourself, your peers, like really any C-level leader at OutSystem, be it on the digital technology side, operation side, financial side, clinical side, is around access, right? Like a problem that's been around forever, but a problem that is very real and amplified, I think, for Americans across, or Americans looking and searching for care here in the U.S. And equitables in particular, right? The focus on equity, I know that's near to your heart. You speak about it, you've written about it, and I always find your perspective to be very refreshing there. With the two hats on, the digital leader who's also looking to solve for access, like where do you see the potential for some of the technology, the AI technology, to really move the needle there?
It's incredibly interesting. My hope is that it's going to be a multifaceted solution, right? And so I think about it from the perspective of, I really hope that we're creating a continuously, more engaged consumer who has taken even more ownership of their health, and that we're providing consumer-based tools to people in order to have them do that. And that we are taking an accessibility lens to direct to consumer tooling that we're developing. So, there's an interesting sort of gap that I've witnessed in that there was this really great sort of movement toward consumer-driven sort of AI tools, but also just like consumer-driven technologies to help people manage their health. And then I watched us, it felt like almost purposefully, even though I know that it wasn't, develop those things for middle America. Their price point was for middle America. Whether or not you needed internet connectivity to utilize them was for middle America. Which endpoint devices the applications would run on were for middle America. And so for one, I would say, I hope that we're going to sort of take a step back in the broader lens of health equity and think to ourselves, like, if we're developing direct to consumer products, which populations are we missing by not thinking about how we apply our technology to certain endpoint devices or to low, bandwidth technologies or to, rural communities, and that we're going to take a different slant and make those things more accessible, because it changes the impact that those populations will have on the healthcare system, the sort of that ability to self-manage. And then
Absolutely.
On the other side of that, right, as we think about the healthcare system and creating accessibility, it's that appropriate matching. And this is one of the areas that I think, AI has amazing opportunities for application, right? It's just like getting the matching right, getting a real understanding of the person and their problem, and a real understanding of providers in all of the points of entry into the healthcare system, and actually taking more of that navigation function and helping people enter at the appropriate place and at the appropriate time. I believe that there are amazing applications for AI to help us do that. My perspective was, we created the role of healthcare coordinators. And when that happened, I'm just going to be super transparent and say, I just went, oh my God, we failed. Because my perspective was, if you need an entire group of people, if it takes an entire discipline to help people understand how to navigate something, that thing clearly is not simple. That thing clearly is not accessible. That thing clearly is not for everyone. And so from my perspective, it's saying, well, what do we need to do to continue to further simplify the healthcare system? One of those is where and how you enter. Obviously, then it's where and how you get treatment. And then, of course, it's where and how you pay for it. Right. And so for me, it's really working with our teams to continue to look at those journeys and those perspectives of our consumers and ensure at every area where we have opportunities to create that type of convenience around how you enter our healthcare system, how we provide you care, and ultimately how you utilize your resources to ensure that you're getting what you need, that we are making ease of experience in each of those types of journeys. But that's where I hope, there are going to be additional applications of this really awesome new tooling that we have, right? So human logistics and creating the right matches and taking into broader consideration demographics when we're doing those types of matches. I think those things are going to be incredibly relevant solutions. And I, for one, look forward to using and implementing them. But
yeah, no, I think you see me kind of jumping out of my seat because I'm excited about what you're sharing, and I think it's super balanced and thoughtful. A buzzword often today is a digital front door, right? And kind of what you articulated is like that's still and very narrow, right? It could be the back door, the side door, the garage door, future door,
100%.
It is. Yeah, we need to be thinking about how people get to and find and receive the care they need, and then like often people just end the sentence there. But what you said after the comma is so important because we as just people are paying for so much more of our healthcare. It's not just about the care now, but
that's exactly
the cost,
right.
the convenience, and then the care.
Not only that, don't just open me a door to your building. Preferably, give me the door to the town, right? So send me to a community-based organization. Send me to the hospital. Send me to urgent care. Send me to all of the places where my wellness can be cared for and managed, right? And so to me, that's the other part of the magic is like really getting that broader understanding of the healthcare ecosystem and all of the different groups that are invested in me as a human being well, and then letting me figure out how to navigate and take best advantage of the whole thing, right? Instead of one aspect.
Absolutely. I'm going to switch gears here slightly, but it's in line with what you shared. So you talked about getting to know the people, right? The patient, the provider, staff. And so data has a huge part to play. And I know you have a point of view there, like talk to us about data and how relevant and important it is to make these technologies real and impactful.
So incredibly important, right? There's so much in the news right now about data. And we've been having the who owns the data conversation for an incredibly long time. And for me, I've been watching some of these cases going, oh my goodness, it's finally here. They are going to make us answer these questions because legally now we have to, because we have all of these new use cases for data. And I think that's true in healthcare, right? When I think about the data conversation, I go back to the AI conversation, which is all of the things that we've been talking about in order to make our data useful are still incredibly relevant. If we want to be able to utilize them for artificial intelligence to build algorithms, models for bias checking, we need appropriate data sets in order to develop these solutions to know whether or not they're going to work for everyone. So data is magic, right? It is going to be and continues to be the liquid gold, but only if we take the time to make it valuable, which means we have to have appropriate GUIs at the front end so that people can capture the data in appropriate context so that it can be then appropriately interpreted, right? We've got to have appropriate data quality and data lineage tools. We've got to have great data integrity. We have to have data stewards. And so there's this whole infrastructure that I think people who sit in my seats and chief data officers and chief AI officers and all of these folks in the ecosystem have been talking about for a really long time, that my goal is to be like, oh no, like the ability to actually economize it. And I don't mean data sales. Let me just be very clear about that. I don't mean data sales. I don't mean tokenization. I mean literally like building the actual data economy that helps us find value from it. Like that time is really here. And so now we can go back and say all of those pieces of the infrastructure that we needed, I can actually create a super clear sort of contribution margin toward which pieces are going to help create that value, and then really make ease of business case in order to get those things implemented. But for the longest time, right, we've had these organizations that were sort of way out there on the data front, weren't necessarily always clear about how we would use it, but maybe knew this future was coming. And I think there are a lot of organizations who are going to be sort of playing catch up. The other thing that I think about on the health equity front that I really would just implore us all to remember is to continuously ask ourselves, who is missing from the data set? So when you think about the data being useful, when you think about how you're going to use it, when you think about the infrastructure around it and ensuring that you have the appropriate digital ethics and consenting, hey, I will remind everybody of that. But when you think about all of those things, please don't forget to ask who is missing from the data set so that you can then create the appropriate integrity for how you will make future use. That's so incredibly important.
No, heart is full hearing that. The completeness of your data to reflect the community that you ultimately aim to serve is critical. And I hear you. I think it's often forgotten in the right intent to use the power of data and drive impact. But we have to be thoughtful about like, what is the data we're starting with? Super good reminder. This has been an incredibly like relevant, impactful 20 minutes, but I have to ask you one more question. And it's coming back to the theme, which was like innovating with purpose, strategies for meaningful investment in AI. Like your advice for your peers, teams, boardrooms across the spectrum of healthcare delivery organizations here in the U.S. who are asking themselves this question is, how do I make meaningful investments in AI? Like what is, like you touched upon so many amazing things around having grace and empathy and the focus on equity and the importance of data, but like just your advice as people are really grappling with this real question.
Yeah. So, my biggest piece of advice would just be, how do I make meaningful use of AI? Just let that be your third or fourth question. Just don't let it be your first question. Right. So my biggest piece of advice would be first ask, what is my strategy and where am I going? Then what are my problems and how do I solve them? Then who's going to be impacted, by if I solve or if I don't? How do I prioritize? And then somewhere around question 3, 4, 5, or 6, ask, how can I make use of the new technologies at my disposal in order to create easier, better, faster solutions to these problems? So that would be my biggest piece of advice, because there are lots of us, right? Lots of technologists, lots of informaticists, lots of data people who are super ready to provide the solutions. The magic is going to be if we ask the right questions.
Well, I think that is the right mic drop and the right way to wrap today. But it's such a treat. Anika, thank you so much for sharing your time with us.
Thank you for having me.
I will say, I spend time with digital leaders all across the country, and I think you have one of the most balanced, thoughtful, and relevant, and just really refreshing perspective. So thank you for just being real and reminding us of like what we need to be thinking about and where to start when it comes to applying technology, any technology, but especially the AI technologies that are in front of so many of us. So thank you.
Thank you. Thank you for having me.
We'll see you. Well, that wraps our Digital Health on Air episode for this week. And what a phenomenal guest. And we look forward to seeing everyone next week and the weeks to come.